In this video, I'd like to talk about the topic of anti-aging methods as explained by a neurosurgeon. Getting older or aging is a sad reality that no one can escape. That's why I believe anti-aging secrets and treatments are a matter of interest for everyone, regardless of age or gender. When you think of anti-aging, most people probably think of procedures at a dermatology or plastic surgery clinic, especially things like lasers or fat grafting on the face. This is because the visible aging of the face, with its wrinkles, is often a bigger concern than the aging of our internal organs. It's also because cosmetic or plastic surgery procedures can bring about dramatic changes in a short amount of time. People spend a lot of time and money to improve their appearance, but those aren't the patients who come to a neurosurgery clinic. Most of our patients have nervous system diseases, vascular diseases, immune diseases, and we also see many patients with autoimmune diseases or dysautonomia. These patients sometimes undergo treatments like immune therapy or stem cell therapy to improve their uncomfortable symptoms. But something that people who've had these treatments often tell me is that after getting stem cell therapy to treat their various other symptoms, their skin complexion improves, their skin tone gets better, their hair becomes thicker and grows well, or they feel less tired when they wake up in the morning. Many people say things like this, and I think this is exactly what we commonly think of as anti-aging. We also frequently see improvements in the body's metabolism. For instance, it's not uncommon for conditions like hyperlipidemia to get better. In fact, I've seen many cases where liver function tests and cholesterol levels have improved. I believe this is because a sufficient amount of stem cells injected into the bloodstream circulates to every corner of the body. They improve inflammation, boost immunity, and enhance blood circulation. As the body becomes healthier from the inside out, the complexion of the face naturally improves as well. The principle by which stem cell procedures prevent aging and have an anti-aging effect is simply this. It increases the number of stem cells, a number that absolutely decreases as we get older. As we age, the number of stem cells circulating in our blood gradually decreases. When you get a cut on your skin, if you have an abundance of stem cells in your blood, the wound heals faster and leaves less of a scar. This is because stem cells travel to the site of the wound and regenerate the damaged tissue. Try comparing yourself from your childhood to the person you are now. Most people will probably feel that in their childhood, wounds healed well, colds went away quickly, and their body's recovery ability was excellent. But as they get older, they notice that this regenerative and recovery ability declines. This phenomenon occurs precisely because the number of stem cells circulating within your blood vessels gradually decreases. So the method is to supplement the stem cells and increase their absolute number. There are stem cells that haven't yet entered our bloodstream and aren't circulating, but exist in a stored form. These are found in our fat and bones, so we extract stem cells from these areas and administer them as a treatment, much like receiving a nutritional IV. This is the fundamental concept and principle behind anti-aging stem cell procedures. Furthermore, the amount of these stored stem cells is so abundant that we could never use them all in a lifetime. They also replenish quickly, which means they can be very helpful when our bodies are aging. When people hear about stem cell therapy, they might think it's a vague concept or wonder if it's difficult, dangerous, or complicated. In reality, you can think of these stem cells as your body's own relief pitcher, capable of restoring and regenerating your body. However, this relief pitcher isn't actively playing, it's kept in storage. The concept is to take it out and let your body use it directly. Therefore, it can be used to maximize your body's own regenerative abilities without significant risks or side effects. Of course, the stem cells I'm referring to are not subjected to culturing, genetic manipulation, or any other artificial chemical processes. I'm talking about fat-derived stem cells, which are made by extracting fat from one's own abdomen, or bone marrow-derived stem cells stored in the bone marrow. In other words, I'm referring to adult stem cells. So I hope you won't think of stem cells as something vague, difficult, or scary. Instead, think of it this way. I have cells that can save me, that can restore and regenerate my body. I can't use them right now, but they're in storage. The idea is to take out those stored cells and use them when you're struggling, when your body is in distress, or when you need extra help with recovery. Viewing it from this perspective is the core concept of stem cell therapy for anti-aging. I think it's something worth taking an interest in. Think about going to a dermatologist for a laser treatment. You have a consultation, lie down on a bed, and the doctor performs the procedure. It's similar with stem cells. You'll receive an explanation about your situation, how it can help, the potential benefits for you, and whether there are any side effects. If you listen to all that and decide you want to try the treatment, the process itself is quite similar to getting a laser or having a mole removed. It's not a complicated, dangerous, or difficult procedure. You can think of it as something quite simple. For fat-derived stem cells, we use areas with a lot of fat, most commonly the abdomen or buttocks. We inject an anesthetic and a solution to dissolve the fat into the fat layer. Then we insert a cannula to extract the fat. The whole process, including anesthesia, usually takes about 30 minutes to an hour. On the other hand, for bone marrow-derived stem cells, we look for the largest, most prominent, and least painful bone in the body, which is the bone at the back of the pelvis. It's the bone along the belt line. This protruding bone is located about 1 to 2 centimeters beneath the skin. We apply local anesthesia to that area, and there's a specific needle that can penetrate the pelvic bone. A needle is inserted into the anesthetized area to draw the blood from inside the pelvic bone. This blood is called bone marrow. This whole process doesn't take very long. It usually takes about 10 to 20 minutes. The duration stem cells are active in the body can vary by study or paper, but generally they circulate in the bloodstream for about 3 to 5 or 6 weeks. Then they settle into specific tissues or organs, enter the cells, and begin to differentiate. The initial effects you see after a stem cell procedure come from the growth factors that are injected along with the stem cells. Whether they're from bone marrow or fat, there are growth factors, and as the stem cells move through the blood, they also secrete a regenerative substance called exosomes. Because of these stem cell secretions and growth factors, some people notice changes within the first 2 to 3 weeks. In other cases, when the cells enter a specific organ or tissue and differentiate to perform a beneficial function, some people may see effects anywhere from 2 to 3 months, up to 6 months, or even a year later. The timing of the effects really varies from person to person, so it's difficult to say exactly when a certain effect will appear. However, early changes can be seen in 2 to 3 weeks, while others may take up to a year to manifest. For fat-derived stem cells, it's certainly better to fast for a bit. However, for bone marrow-derived stem cells, that's not necessary. Since it's done under local anesthesia, you can come in after having a meal. However, sometimes when stem cells need to be cultured, which is done at a few institutions and companies in Korea that are licensed for stem cell culturing facilities, the procedure is different. When culturing is required, your stem cells are in a place where other people's stem cells are also gathered. Therefore, we need to check for any infections such as tuberculosis, syphilis, or AIDS. To rule out these inflammatory or infectious diseases, we need to run blood tests and other infection screenings. But for adult stem cells that are not cultured, meaning we extract, separate, and immediately use your own stem cells from your fat or pelvic bone, no special tests are required. Compared to general treatments, it is expensive, and since it's not covered by national health insurance or private indemnity insurance, the financial burden can be significant. However, for certain symptoms or diagnoses, stem cell procedures can sometimes be covered by private insurance. So the cost is the biggest hurdle. The treatment itself isn't dangerous or have many side effects. If an inexperienced or unskilled person performs a stem cell procedure, there are generally two main problems. First, the effectiveness is reduced. You might have stem cells, but they could be injected into your blood vessels with all the cells broken. The quality of stem cells can vary greatly depending on how they are harvested and how they are separated. The process of injecting them into the patient, there's a lot of know-how involved. And this know-how is proprietary to each hospital, so I can't disclose everything. But when you choose a hospital for a stem cell procedure, the process seems very similar. But are the stem cells entering your body actually intact? Or are they just a bunch of broken cells? There's no way for the patient to know, and that's a real blind spot in the process. The other issue is related to risk. Especially with fat-derived stem cells from the abdomen, a cannula is used to extract them from the fat layer. But if the doctor is inexperienced, the cannula can pierce the peritoneum. Or a fat globule can enter a blood vessel, leading to a terrible incident like a fat embolism. So experience is important. What can also help is using an ultrasound to see the location of the abdominal fat. This allows for a safer extraction of higher quality fat. So, a fat stem cell harvesting method that utilizes ultrasound can be very helpful. As for bone marrow, neurosurgeons and orthopedic surgeons have a lot of experience extracting it for bone fusion surgeries, so they don't find it particularly difficult. However, specialists in other fields might feel quite apprehensive about inserting a needle into a bone. Due to a lack of experience, they might insert it in the wrong place, damaging nerves or blood vessels. That's why, in Korea, especially in the Gangnam area, there are quite a few clinics offering stem cell procedures these days. Most of them focus on fat-derived stem cells. It seems to be true that many feel there's more risk or burden associated with bone marrow stem cells. However, for bone marrow, if the procedure is done with a precise understanding of the pelvic anatomy, using tools like ultrasound or X-ray to pinpoint the location, it's much closer than fat. And even in patients with no fat, the bone marrow is rich in stem cells. Of course, if a patient has plenty of both fat and bone marrow, we can use both, or we can just use fat. Appropriately combining the two is also a good method. So the risks I'm referring to are for fat-derived stem cells, perforation, damage to organs, or an embolism, where fat enters the bloodstream. For bone marrow stem cells, if the needle is inserted incorrectly into the bone, it can damage nerves or blood vessels. However, our clinic has probably performed the most bone marrow-derived stem cell procedures in the country. The number is in the hundreds, but we've actually never had any problems during the stem cell harvesting process. Nevertheless, because such risks can exist, if you're considering bone marrow-derived stem cells, you should also pay attention to these potential side effects. So, in conclusion, it's the same for any procedure, but receiving it from an experienced, skilled doctor who has gone through trial and error. And this applies not just to stem cells, but to everything: cosmetic skin treatments, procedures, and surgeries. I believe that level of skill is a very important part of any medical service. But that judgment, well, is something you'll have to make. As for anti-aging methods, it's true that treatments that intuitively address visible wrinkles like Botox, fillers, and fat grafting are the first things that come to mind. However, through stem cells, you can achieve anti-aging by improving the aging process from inside your body. I believe they absolutely have that capability. So, from an anti-aging perspective, when we use the bone marrow or fat stem cells that we do, there will definitely be many benefits. That's what I've come to think.